Welcome to Dean's Chat. I'm your host, Dr. Jeffrey Jensen, Dean of the Arizona College of Podiatric Medicine, and we have an exciting show for you today. As promised, we'll be discussing all things podiatric medicine. We're going to touch on academics, clinical, research, and administrative topics within our profession. Today, it gives me great pleasure to introduce our guest speaker, Dr. Rob Snyder. Dr. Snyder is currently the Dean at Barry University School of Podiatric Medicine. He is a world-renowned researcher. He is a lifelong learner, as you will find out soon, and he has served in significant administrative roles such as president of the Association for the Advancement of Wound Care. He's also on the board of directors for the American Associations of Colleges of Podiatric Medicine, and he is a fellow in the Royal College of Physicians and Surgeons, Glasgow, Scotland. Welcome to the show, Dr. Snyder.
Thank you very much, Dr. Jensen. I appreciate the opportunity.
Keeping with the Dean's Chat, fireside chat theme, what I'd like to do is be a little more informal. And for the rest of the discussion, you be Rob and I'll be Jeff.
Of course. Sounds good.
So, Rob, as an introduction, can you share a little bit more about yourself personally and professionally?
So I've been a podiatrist for over 40 years, and for about 27 of those years, I've been involved in clinical research on wound-related products and advancements in wound management and limb preservation. I've also written pretty close to 200 peer review and trade journal papers. I have several degrees. I have a master's degree in business administration. I've taken the course at University of Wales College of Medicine with Keith Harding on wound management and tissue healing. And most recently, I was a global clinical scholar at Harvard Medical School on clinical research.
Well, fantastic. We'll touch base on all of those things throughout the discussion today. And how about your family, Rob?
I am married. I have two very wonderful children. I have 4 grandchildren. They live very close to me, about 1.5 miles away. So I have an opportunity to go to their baseball games and their dance recitals. And it's really a wonderful life, really. I live in Florida. And so the weather is really very good. So we have an opportunity to really do a lot of things together. And I feel really very fortunate.
That's great. When I introduced you, we really didn't emphasize the doctor of podiatric medicine. And you've seen our profession go through lots of changes and evolved over the years. What does the letters DPM mean to you?
So Doctor of Podiatric Medicine really separates us in a good way from our colleagues. I think it lets the public know exactly what we do. Of course, many people still, even to this day, don't know what the letters DPM actually mean. But you and I, of course, know that we basically are physicians that specialize in the lower extremity. I think certainly we're working towards kind of equalizing or leveling the playing field, if you will, by creating parity between our allopathic and osteopathic colleagues. And I really do believe that DPM really should be equal to DO and MD.
Well, that's great. I agree with you. I know you've evolved from being in practice and doing clinical trials to being faculty at Barry, and now you're the dean. I think one of the neatest stories is that when you became the dean and your roles changed, you actually brought your practice and folded it into the university.
I did. So I made a decision that we needed another clinic. One of our clinics was closing. I felt that my practice was vibrant and I thought it could be a benefit to the school. So I donated the practice to the university. That office now has quadrupled in size. We now have a new classification. We have the podiatric clinician, who is not a faculty member, but is working in the clinic. He is teaching or she is teaching students, but doesn't have a true faculty role. So we're making sure that all of those holes, if you will, in our schedule are completely filled. So these individuals really are working 5 days a week to help build the practice. And I'm very happy to say that from the time that I started, and I'm working with our clinical expert, that we've been able to go from a deficit to pretty much breaking even with our clinics. And I really believe that over the next year or two, we will actually be in the black with those clinics. So I'm very proud of that.
Well, that's a great accomplishment when you consider how much teaching actually occurs in the clinics in addition to seeing patients. So,
correct.
So I'm interested in knowing now that you've been the dean, how many years now? 2 or 3 years?
2 years.
And being a dean has a different skill set, of course. And how are you adapting to that? You've got a lot of balls in the air, being the dean, lots of responsibilities. What does your typical day or week look like?
So there's a lot of administrative duties, of course. We're working to finish our strategic plan. We're going to be looking at an accreditation visit over the next year and a half. So obviously, we're spending a tremendous amount of time doing that. I also teach a class on wound management and limb preservation. As you know, when I came to the school, when you actually had hired me, one of the things that I wanted to do was to create a course specifically related and dedicated to wound management and limb preservation. I really believe that that's really where our profession is headed, and I think will make us sustainable in the future. So I still teach that class, and I do deal with students as well, but obviously on a very different level. It's a very interesting job. Certainly, it does require a different skill set. I mean, I was chief medical officer for a pharmaceutical company for 5 years, so I do have a lot of business experience. I ran a practice for 40 years, and I have an MBA. So, I mean, there's a lot of crossover skills that I've been able to use in this job.
Well, that's fantastic. When you and I first talked about doing this talk together, we talked about the meat and potatoes, right? You and I have worked together for many years in clinical trials. And so my question to you is, being a prolific author and a prolific researcher, how did you get your start in research and clinical trials? And a follow-on question would be, who have been your mentors over the years?
So I've had several mentors. I actually got involved in clinical research through my colleague, Jason Haft. Jason Haft had been involved in clinical research for many years before I met him. And I had an interest in this, and he was kind enough to kind of show me the ropes, if you will. Showed me about budgets and having a better understanding. Since that time, of course, I've taken many courses. I've done a tremendous amount of introspection and learning. So I've developed an expertise in that area. Of course, Robert Warner was another mentor of mine, a mentor of yours as well. And he really would kind of have these very frank conversations with me about, what he felt I should be doing and where my career, potentially could be headed. So I'm very fortunate to have had mentors in my life, and I still have mentors. I think one of the things that students miss sometimes is the fact that they don't develop those relationships with either faculty members or people that they meet at meetings or seminars. I mean, mentorship is absolutely the key to success.
Absolutely. So how many clinical trials have you participated in, do you think?
Pretty close to 70 at this point. Most on the diabetic foot, but we've done many trials on venous leg ulcers. We did a trial on pyoderma gangrenosum and the utilization of a drug that would mitigate those symptoms. We're currently doing a trial where we're injecting a growth factor into the lower leg to stimulate angiogenesis and heal wounds. So, again, the research that we're doing at Barry is very high end. I mean, we have studied dressings in the past, but now really we've moved on to some very sophisticated trials. We're also doing a lot of work with cell and tissue-based therapies. many of these studies, unfortunately, are not successful, and those products never make it to market. But the ones that do really can change the lives of millions of people. It's really a passion of mine. It's something that I continue to study. You know, as you mentioned, I'm a lifelong learner and are constantly looking to improve. I'm actually thinking of taking a biomedical ethics a course at Harvard. So that's kind of my next, once the accreditation visit is over, I think that's going to be my next project. Yeah.
Wow, you are a busy guy. So let me ask you this question. Your first master's degree from Cardiff, can you tell us about that? That was wound care specific also, right?
Very specific. Yeah, it was really all wound care. A lot of it was, when I took the course in 2012, Zoom and those kinds of platforms were really not available. So we did do a lot of online work. We did have to also go to Cardiff twice. Again, we also had to write a thesis, which I found very interesting. You know, for me, having written so many papers, I thought it would be kind of a cakewalk. But writing a thesis is very, very different than writing a paper for a peer-reviewed journal. I learned a tremendous amount. I then was asked to be an instructor for Cardiff. I then moved up and I'm now a professor at Cardiff on a voluntary basis, of course, and I help teach their wound management limb preservation course. It goes through really all of the stages of wound healing. It talks about the various wound types and various current therapies, and all of it is evidence-based. So it's really a course that helped me significantly kind of hone my skills.
You know, speaking of education, I remember we used to teach together for Healogics and diversified clinical services, and I could sense when you were lecturing, and we'd have full houses, 80 doctors in town. You'd be talking about normal and abnormal wound healing. It was obvious that Cardiff experience really paid off for you.
Yeah, it did. It did, and I enjoyed it, and I also enjoyed working with you when we were working on a monthly basis to teach that course. Yeah.
Yeah, I enjoyed it too. So that was your clinical master's. Let's talk about George Washington University and your master's degree there.
So I decided that if I was going to really move forward in really understanding business to a much more deeper degree, I wanted to foster my education. So I looked at various programs. The MBA really that I took was health related. So there were a lot of electives relating to health and insurance and how healthcare is moving from the ability to just do procedures to a value-based system. And I think it's really very important that I understand that. And I have since I've taken that course. That master's degree actually was 60 credits, which is really much longer than the average MBA. But I felt that because I was getting those extra electives in a health related field, I thought it was going to be really beneficial, and it was. I learned an awful lot, and I made a lot of good contacts too, which I still am in touch with.
Fantastic. So let's shift gears a little bit and go into the colleges and schools of podiatric medicine. When a student is applying to Baylor University, what kind of attributes are you looking for in a student that will be successful?
Well, obviously, we want to make certain from an academic standpoint that we feel that they would be able to undergo the rigors, particularly of the first 2 years of training. And of course, that is predicated on how they did in their undergraduate work. I'm a big proponent of looking more at the second and third year of how they did rather than the first and second. Students who are starting college for the first time, who have really never been on their own, sometimes they don't do that well the first year. So we lean much more heavily on the second and third years just to see how they've done academically. Of course, the MCATs are important. I kind of vacillate as to how much weight we we really should be placing on those. I don't really know if there's a correlation necessarily between the MCATs and how students would do. I mean, some of the most successful students did not do well on the MCATs, and we took a chance on them, and they've done just tremendous work. Secondly, we look to see what their personality characteristics are. I mean, are they going to be good doctors? Are they going to be compassionate? Are they going to be competent? All of these things are very important. So I think you need kind of a holistic overview when you're evaluating these students, not only from an academic standpoint, but also to make certain that they're going to have the personality skills that are going to be appropriate to be in the medical field.
Absolutely. You had mentioned talking earlier about your family, and many of our students come to professional school today and they have families, and above and beyond that, they're concerned about work-life balance. And you and I have discussed this a lot over the years. And what do you tell a student when they ask about going into podiatric medicine? They're looking for work-life balance, almost as though that might be provided in podiatric medicine, different than it would be in an allopathic program.
Right.
What are your thoughts on work-life balance?
So I think work-life balance has to be earned. When you're starting out in practice, or when you're hired to work in a larger practice or a multi-specialty practice, I think you're going to be working as hard as you would in any other field. You're going to be taking call. You're going to be operating on patients with diabetic foot infections at 11 o'clock at night. I mean, there are going to be times when you're going to be working a lot harder than you would imagine. Now, over a period of time, obviously, as you hire more, or you get more individuals in your practice, certainly the hospital rounds become less of an issue because you're kind of sharing those responsibilities. But I do believe that that work-life balance in podiatry is really no difference. And it's almost kind of a myth, if you will. But I do believe that once you earn it, I think it's something that you can enjoy. And perhaps, just perhaps, in podiatry, it may come a little sooner than if you were a primary care doctor, as an example, running around seeing 60 patients a day and not having time to breathe. So, that could be the answer. But I do believe at the very beginning of their career, and certainly for the first 10 or 15 years, if they're practicing podiatry the way they should, work-life balance is no different than any other medical specialty.
I agree with you. I think one of the neatest opportunities for our students from all the colleges is the opportunity in the fourth year to travel around the country and spend a month at some of the very top academic programs that our profession has to offer. And your thoughts on that, because truly it prepares them for boards part 2, and it really prepares them for the residency experience. Your thoughts on rotating around the country?
So I think it's a wonderful idea. I think, obviously, particularly in our school, the clinical faculty that teaches the classes also very often is in the clinics. So you get a kind of a myopic view of how things are done. So it's really very important that you travel around, that you see how other clinicians practice. You see what the standard of care is in different parts of the country, because standard of care really is not something that is global. It's something that really is indicative and very specific to a particular area where you're practicing. So I think that's very, very important. They also have an opportunity, again, to developing these mentoring relationships. One thing I would add, though, I think that we need to incorporate more medicine into our curriculum. And sometimes that can be done in the fourth year, particularly once the students have solidified where it is they're going to apply for residency programs and what have you. I think I get the sense very often that students are going into these residency programs and they're kind of learning on the job. And it's very important for them to really be able to understand medicine before they can really do surgery. So I would certainly suggest that perhaps towards the end of the fourth year, that some of those experiences are really with medical doctors, so that they can really get an idea of how to examine a patient appropriately. Obviously, they're going to be doing that very specifically specifically in the residency program, particularly in the first year. And again, I think it's important that they are comfortable with the process. They're comfortable with, looking at blood values. They're comfortable looking at angiography, et cetera. So all these things are critical. And I think if they're added, I think it would just add to the academic experience that the students will have.
Absolutely. And one of the other neat things about our profession is there's a residency position available for every graduating student. I
Correct.
think that's really a valuable aspect of our profession when you go through the educational process, knowing that that's there at the end of 4 years,
Correct.
years of school.
And as you know very well, we couldn't say that a few years ago.
Absolutely.
So I think we're in a very good position now as far as students being placed in residency programs.
I agree. And so not everything is always rosy, right? I mean, every profession has their challenges. One of our challenges, of course, is our applicant pool. And, it's a kind of a conundrum because when I talk to students that are coming to our college in Arizona, they've all had the great experience of shadowing a podiatric physician, surgeon. They think that it's the greatest profession ever. The doctors are sharing with them that, oh my gosh, it'd be great to have somebody like you in our profession and be a colleague. Yet that's not translating into student recruitment and applications. And we've seen a tick downward over the last few years. What are your thoughts on that?
I wish I had an answer for you, but I really don't. It's really a puzzle for me because, to your point, podiatry is a wonderful field. I think one of the problems is that the advisors in many of the top colleges really don't even know what podiatry is, and even though we've tried to educate them, they just don't even bring it up in the course of conversation. So it's either allopathic, osteopathic, or nothing, or dentistry. So I think we need to educate them. We need to further educate the public. Johnson and Johnson had done a blitz campaign on nursing and the importance of nursing in medicine. And that was a very, very successful program. I think perhaps linking to maybe a large company that could do a very similar thing for podiatric medicine and surgery would be very beneficial. I wish I had another answer. I mean, we're trying to develop programs within our own schools so that we can stimulate our own students to apply to the podiatry program. Podiatry, as you know, has been just an amazing profession for me and for you as well. I mean, and you can go anywhere you want with it. I mean, it doesn't have to be private practice. I mean, just looking at you and thinking about what you've done in the business world and what you've been able to create. I mean, it's just been amazing. I mean, I've done many things. I probably had 5 careers so far in my life, and probably will have a 6th or a 7th before I'm done. So there are many things that we can do as podiatric physicians. People really want what we have to offer, and particularly in the wound management space. I mean, we are an integral part. That is one area where there is really very little redundancy in what we do. And I really believe that is going to, and I mentioned this earlier, but it's worth repeating. I really think that that's going to sustain us as a profession. As you know, they're starting to, in earnest, develop these inpatient hospital programs for diabetic patients that are limb preservation programs where patients will be admitted and they'll be worked up, and within 24 to 36 hours, we have some answers as to how these patients should be treated. David Armstrong's, toe to flow is a wonderful example of the importance of podiatry in that model. So certainly there are many things that we can do. I mean, surgery obviously is an important aspect, whether you're dealing with wound management or you're dealing with a Charcot deformity or a bunionectomy. So you need those skills. I'm hopeful that most residencies will incorporate those skills into their programs.
I think so too. And one of the other things I think we need to emphasize is if the shadowing experience is that important, and I believe it is for prospective students, we need to connect the universities, our pipeline schools, universities that are sending students into podiatric medicine. We need to connect them with the doctors so they can, it's almost a knee-jerk reaction to get a great shadowing experience.
Well, one of our deans had a very interesting idea, and that was to stimulate doctors to at least speak to one student that would be a prospective podiatric medical student. So if you have, let's say, 12,000 podiatrists in the United States, even if half of those individuals were able to get students to apply to our schools, we'd have, 6,000 or 7,000 applicants. Right now, we're probably in my lifetime probably at one of the lowest ebbs as far as the number of individuals that are actually applying to podiatry programs. I don't think it's unique. We're looking at nursing programs. We're seeing that bachelors of nursing are kind of going by the wayside. A lot of nurses are going into nurse practitioner programs. I think the PA programs have been, kind of another conduit for individuals who want to go into medicine. And, it's a little bit of an easier road. It's a shorter time frame. It's less debt, et cetera. So I think that's also been a factor as well.
I think so too. Shifting gears again, you and Sandra have been extremely generous and philanthropic at Barry University. You started a new scholarship last year. Would you mind sharing with everybody what that's about?
So my wife and I, thank you for mentioning it. We're very proud of it. I know you have also been extremely philanthropic in your life as well. So I'm kind of preaching to the choir here. But what we did was we created an endowment, and this endowment is predicated on sending students that are interested in wound management, limb preservation, and or research to a major meeting in the United States. Where we're offering all expenses paid, airfare and registration and food and lodging, et cetera. So the student gets an opportunity to pick which program they want to go to, as long as it's relating to the topic at hand. So we have them write an essay, very short essay, but also we ask them, if possible, to come up with some kind of research idea that they would consider pursuing at some point in their professional careers. And we did choose one individual, very qualified, very excited to go. And she did go and had a wonderful experience. And I'm hopeful that within the next 10 to 20 years, which is what we've really funded, that many more students will be able to have that opportunity.
Oh, that is just great. What a great idea. You're kind of setting the stage for the next generation of researchers and authors in our profession.
I'm hopeful that will happen. Yeah.
Oh, that's fantastic. All right. On the lighter side, Rob, tell the audience something that they wouldn't know about you.
So I was a professional musician. I actually played the keyboard and the piano, and I did that much earlier in my career. When I finished high school, I was thinking of going to music school versus just a regular college. I wasn't really sure what I wanted to do at the time. And I knew I was good, but I didn't know that I was great. And, I felt music was kind of, interesting and something that I would have loved to do, but I just didn't know long-term how that would work out. So I decided to go to a regular university. And the first course that I took actually was biology. And I just fell in love with it and said, this is really what I want to pursue. So I majored in biology and really was very focused on being a physician.
What was the name of your band?
The Chapter 5.
The Chapter 5.
Yeah.
And were you?
We did record a record. For RCA. Mm-hmm. I think I have the only copy. But it was very interesting because at the time, it was the late 60s. So when you go into the studio, you have to sign in. And, you saw these names, Connie Francis and all of these very famous people at the time that were signing in because they had been recording that day, and there we were. And it was an awesome experience. It was very, very interesting and something that I remember, to this day.
Oh my gosh. Did you have a nickname or anything?
I did. I did. They didn't like Robert Snyder as a name. So and I know this is now going to be public knowledge, but I don't mind sharing it. Yeah. They changed my name to Robbie Cinder.
Robbie Cinder.
Bobby Cinder. Yeah, they felt that that was more in tuned because we had some other people in the band that had incredible names. I mean, one individual's last name was Love. His name was Buddy Love.
Wow.
I mean, how much better could you get than that? So Robert Snyder just didn't kind of fit the mold, you know. But I also played at, bar mitzvahs and weddings and, those kinds of things. I would be called in if a piano player couldn't make it, I would be called in. And we had this fake book we'd open up with chords and, I would manage to kind of muddle through. It was a lot of fun. And I still to this day, the first piece of furniture that I actually bought in my house, other than my bed, was a piano.
No kidding.
Because I wanted a piano in my house. Yeah. And I play every day. I still play every day.
Oh my gosh. What a great story. We've had musicians as residents, and people that can play musical instruments turn out to be great surgeons.
Yeah, it's true. True. Well, playing the piano is really, you're stretching your hands, you're constantly moving, playing the piano is very much like doing surgery because a lot of it involves muscle memory.
Sure. Makes sense. All right. We won't call you Dr. Cinder then.
No, please don't.
All right. Yeah. I've got one more interesting, passion of yours. I know that when you were teaching at Barry, the students I'd see them and they'd say, oh my gosh, Dr. Snyder's the best lecturer. He's all over this wound care space. But really, we look forward to seeing him each week because we want to see which watch he's wearing. Can you share with us some your background in becoming a watch collector?
So horology was something that I just kind of backed into. I was in a store one day and I was speaking to the salesperson and he said at the time, he said, statistically, a man will look at his watch 90 times a day. So if you're looking at something 90 times a day, you really better like what you're looking at. So I bought my first watch, but it is unfortunately it's a very expensive hobby, but I do love it, and we have 17 watches now. And what I do in the morning is I pick the watch first and then get dressed. So, I base my outfit for that day based on the watch. And I'll tell you something else that's really wonderful about watch collecting. My son is an attorney, and he also loves watches. And, I get great pleasure in gifting him, those watches as time goes on. I'd rather see him wearing those watches while I'm here to be able to enjoy it, So that's another benefit of it. But I have to tell you, students are very savvy when it comes to watches. I mean, they will look at my watch and they will say, oh, that's a so-and-so. And they'll be absolutely accurate. Yeah.
So 2 questions. One, what is your favorite watch?
So my favorite watch is the Daytona, the Rolex Daytona. I waited 2 years to get that watch. I was on a waiting list, and it's something that I'd never owned a Rolex before, and all the other watches I've purchased. I like the IWCs. I like the Pateks. I have a few of those. And again, I look forward to giving them to my son. That's really the goal.
What are you wearing today?
Today, I am wearing a Panerai.
Fantastic. So Rob, we could talk for hours, of course, and we have over the years. Is there anything else that you would like to share with the audience?
Just the fact that podiatry is just such a wonderful profession, and it's been very good to me. I think I've been good to it. It's really very unfortunate that we're in the situation that we're in. I'm hoping there's going to be a paradigm shift, and that more students will apply. I think it's a hidden gem in medicine. It's something that is so worthwhile and so rewarding. Particularly, again, I'm very partial to wound management and limb preservation, but for me, it's so satisfying to know that you're able to save someone's limb and ultimately save their lives.
Absolutely. And then flipping roles real quick, are there any question you'd want to ask me?
Well, what have you been doing recently as far as your business acumen, and anything new?
No, I've got a couple patents in place, still looking at nitric oxide and But really, to be honest with you, I've been busy with dean activities. And
Sure.
As we talked about, it's a different skill set, kind of so different than seeing patients.
Sure.
And then I wanted to get this podcast going. So I wanted to make sure it ran smooth. And I've got a lot of help in doing that. And it makes my job a whole lot easier when someone like you and so interesting and has so much to offer comes on the show. So I really appreciate it. And I thank you.
I think it's a wonderful thing that you're doing. I think it's going to bring a lot of information to the forefront. You'll get an opportunity to really speak to deans and really know what their challenges are. What things they're enjoying, what things may be a bit prickly, if you will. So I'm really proud of you. I think you're doing a wonderful service for the profession. So thank you for that.
You're welcome. But yeah, hopefully, not just the deans. We'll be talking to residency directors, and we'll be talking about people in administrative roles within the profession, because I really don't think most people know what goes on in the inner workings of a profession. So I think it's going to be a lot of fun.
That sounds fantastic.
Once again, Rob, I really appreciate you coming on for your knowledge and your experience and your expertise, and thank you so much.
My pleasure. Thank you.
So I want to thank all of you for joining us on the Dean's Chat today. This podcast will continue to highlight all things podiatric medicine. We'll see you next week. And don't forget to give us a 5-star rating. Cheers.